Hi, Kirsten Lindquist of Energy Matters Acupuncture and Qigong. Here to tell you what is a virtual acupuncture treatment like. So if you didn't look at the other video and you don't know what it is, watch the other one that describes the virtues of virtual acupuncture. So this is how it all plays out. You call the office, or you can do it online, make your appointment. You need to make it far enough in advance that we can get you the tacks, here's some visuals on them. You're going to get a bunch of these, sorry, that's how you can see them, in the mail. Or if you live close by and you're comfortable coming to pick them up, we have no contact pickup at our front door, or can send somebody. That's great. So that's the first thing. Just be sure to schedule with enough time to get the tools that you need for the appointment. Then at your appointment time, you will do a video conference call with your practitioner, and just like this will be on video, and your practitioner will be able to see you. You'll check in just like you used to during an acupuncture treatment. What's gone on since the last treatment, which might be 8 months ago. What do you need to work on today? What's bothering you? Is it stress? Is it insomnia? Is it pain? Is it whatever you were working on, with the acupuncture. So that feels all regular. You're familiar with that. You're just doing it by video. Then the practitioner will look at your tongue. We haven't figured out a way to take pulse, but we got enough information from what you've told us and by looking at your tongue. Then your practitioner will decide, they'll take a moment, and I'm writing like this, I'm writing out the treatment protocol. So I'm going to figure out which points you need for whatever you're trying to work on. Then you'll learn how to get these little things out of all this excess packaging. In fact, I have another video that's just about that. It's not hard, but they're overpackaged, but that's all right. And then your practitioner will guide you through finding the points. And that part, for some people, the first time they're like, I don't know if I can do this. I'm not an acupuncturist. So that's another thing I've been very impressed by during this process, is that yes, you can. I or your practitioner will guide you to the point, and I can see what you're doing. We do some awkward things sometimes. Sometimes I'm holding my foot up in like this to show it or whatnot, but we get it done. And then you actually apply the needles, which again, like I showed in the other video, it's like putting a Band-Aid on. Once you find the point, you can either mark it with a fingernail or just visually know where it is, or even a little marker, and then you put the point in there, the tack. And so you get guided through that process. Then once the needles are in, just like when you came into the clinic, you will lay down. You can actually walk around with these things on, unlike with other needles. Lay down somewhere comfortable, maybe get out your eye mask, put on some spa music, whatever you like to listen to, and literally set a timer or know that you're gonna rest for 20 to 30 to 40 minutes, just like you would have if you were in the clinic. And then once you're done, sometimes we'll actually recommend that you keep some of these Band-Aids on for the rest of the day, and your practitioner will let you know. They're very safe. They're designed. That's what they're designed to do, is to, acupuncturists will use these in the clinic and send you home with them. So that's how we've used them in the past. So maybe if you have a pain issue or are very, highly stressed, or an insomnia issue, you may wear these for the rest of the day. Your practitioner will tell you when to take them off. And then you've had your treatment. Now, the next cool thing about this is that your practitioner will send you a list and little links to where those points are, and or we can send you the recording of the session so you can repeat the treatment. So a lot of my patients, what we're doing is that we do a virtual acupuncture treatment together. They do the treatment with my guidance, and then they follow it up 2 or 3 times before their next treatment. And then they schedule their next virtual in about 3 to 4 weeks, and then we check in and we update as needed. So it's not mandatory, but once you've learned how to do it, you can repeat it, get more out of the that protocol, and then we update it, because of course things change. So the treatment that worked a few weeks ago may not be appropriate a few weeks later. So you are actually empowered to give yourself multiple treatments, and then check back in and continue that process. All right, so that's what it looks like. Very simple. Honestly, the hardest thing is figuring out how to get all this plastic off of the, the needle and finding it. Once you figure that out, the rest of it is Your practitioner will guide you to the points. And it's so fun when I see people, I see them going, they're feeling not confident and like, I don't know. And they're like, oh, I feel something there. And I'm like, exactly, that's the point. And now having done multiple treatments with many patients, I see how much more confident they are and how much more they are in tune to their own body and finding the points much more quickly. So that's a very, very exciting part of this process as well. All right, so that's how it happens during a virtual acupuncture treatment.